So can we start?
Yeah, we'll start.
All right, we have about 50 people now, so let's begin.
Yeah, sure.
Every successful homeopathic prescription does not end with selecting the right remedy. In fact, the real art often begins after the first prescription. Welcome to Author Spotlight, everyone, Beyond Writing, Beyond the Pages. I'm Dr. Noori Ali, Senior Homeopathy Editor at BHMS, and today's episode is especially meaningful for students, teachers, and practitioners who wish to deepen their understanding of follow up and clinical decision making in homeopathy. We are honored to welcome a respected academician, teacher, clinician, and now an author, Dr. Shashikant Kammar. Dr. Kammar has decades of experience in homeopathic education, currently serving as head of department in forensic medicine and toxicology department at the Yenapoya Homeopathic Medical College and Hospital. And his dedication to simplifying difficult concepts has helped many students understand the deeper application of philosophy in clinical practice. Today, he joins us to discuss his upcoming book based on Dr. James T. Kent, Philosophy and the Famous 12 Observations. Principles that continue to guide homeopathic physicians in understanding follow up, remedy action, prognosis, and the next step in prescription. So, this upcoming book has been specially designed to simplify these observations and help students and practitioners analyze cases more confidently and practically. Dr. Shashikant Kammar, sir, congratulations on your upcoming book and a very warm welcome to Author Spotlight.
Thank you. Thank you very much, ma'am, for inviting me here. Thank you.
Absolute honor to have you with us today, sir. Sir, let's begin with the problem. Why do
Okay.
so many homeopathic cases fail not at the first prescription but during the follow up? Please give us your
Okay.
insight.
Sure, definitely. See, so many homeopathic cases, they are failing. This is what the point is there at the initial beginning. So thing is that they are not failing because of this first prescription, which is wrong enough. The failure is there because of the follow-up, which is mismanaged. That is very, very important. Follow-up, how the person is presenting the signs and symptoms, that has to be understood properly by the physician, by the interns or the students, whoever is treating the case. The first prescription may be going to start with a curative power. It has got the power, right? Where everybody knows it. It started curating it. And then how it is curating, you will come to know by the signs and symptoms. Okay. But the physician's interpretation of those signs and those symptoms are very, very important, which subsequent changes determines whether this particular case is going towards the recovery or it is going to divert the case from original. This is one point. And there are so many things are there, so many reasons are there why the failure is there. That has to be understood properly. Certain points I will just highlight here. That is misinterpretation. That is misinterpretation of the patient's response. How the patient is giving the symptoms and sign, either it is aggravation, or it may be amelioration, or it may be some other conditions which already existing in the patient. Those has to be understood properly. That is mistakenly understood for the by the physician as a deteriorations, which is not there. That is, interpretation should be perfect. So second point comes here, the premature remedy is acting. Whether this has got particular period where it is acting, can we disturb that flow of that remedy acting in the patient? So that is also important. Unnecessarily disturbing the flow of that remedy is not at all recommended. Repeating a remedy while it's still acting can interfere the natural curative power. Okay, so this is one point. Then many cases are spoiled not by the wrong remedy, but by unnecessary dosing of the other remedy. So these are the 2 or 3 points. One more point I can say that changing the remedy, most of the time it happens. The first remedy is not correct, no given response, so again I have to change it. But the first remedy itself is a perfect remedy. What's the need of changing over there? That has to be understood. So these are the few points which comes here as a failure. So this particular understanding of the language of the patient has to be clearly studied by the students so that the recovery will be better in the prescription and the given manner. So that has to be understood. And because of this, I can say the failure is there.
This is such
Okay.
an
Yeah.
important point, especially for the young practitioners who often
Yes,
focus on
exactly,
remedy.
exactly.
Yes, because they
Okay.
focus on the remedy selection, it becomes a difficult thing.
Yes, yes. And one more
I
point I want to highlight here that most of the time we're seeing the disease. Okay, disease that is what you can say that pathological condition of the patient. So that we're highlighting over there rather than the patient. Patient we are not saying, but this is the condition we're saying, and based upon the disease condition, based upon the laboratory findings and the name of the disease, we're trying to treat the patient, which is again, I can say this is a wrong way. We are not understanding the patient as a whole. If you understand the patient as a whole and prescribe the remedy, there is no need of this laboratory reports. This is what personal opinion is there. So this is also one of the point where the failure comes over. So patient's well-being is very important. That has to be understood by the all the people, all the physicians, or the interns, or the who are treating the patients. Okay.
Absolutely, sir. Wonderful point you said. Sir, Ken's 12 observations are often called the compass for follow-up. Our teachers used to tell them. Why do you think that every homeopathic student and practitioner should understand them deeply?
Definitely, this is I can what say. Basically, we should understand what is the use of this compass, how the compass is used, just to see the directions, what direction it is. That is, everybody knows it. But now this compass for the follow-ups, that means what it tells, what this particular 12 observation tells, and that's the reason I can say this has been told as the compass. So there are things like for every this homeopathy students or a practitioner should understand this observation deeply. Why? Because they help distinguish between two, 3 points like cure and suppressions. So if you see cure, how, in which observation we are going to see the cure. Okay, then for example, I say it is a third observation and all, we can going to see the cure. In suppression, where you're going to say directly go to the 12th observation. There are going to see the suppressions. So these distinguishing points are going to be dealt in the 12 observation. That's the reason everybody should clearly understand what actually this 12 observation tells. Okay. Next point comes like they this particular things teaches us the art of waiting. Now, can I wait after giving prescription or cannot wait? So this is one point, very important point, waiting. But most of the time, what happens? There is some pressure will be there. Patient will tell doctor, as few days back, I had taken the medication for this such and such condition. The symptoms are not going. Still, it is persist. So this patient will commit it. So again, the young physicians or the doctors or they feel, yeah, I give medicine, why not act it? My remedy is correct. I repertoire, I choose a correct remedy. Homeopathy is maintained over there. But why the symptoms is persisting? But the thing what the particular individual forgets is that the general well-being, that is not understood by the patient. Okay, all the symptoms are there. Patient is feeling better, but still symptoms are there. So at this particular moment, can I repeat the remedy? Can I wait? So this is all dealt in this particular observation, 12 observations. So thoroughly study these things. Definitely, this
Sir, you are inaudible right now. I think there is some network issue, audience. Yes, sir, your network was gone, so we could not hear you.
yeah, see there are certain critical questions. Whether is the patient who will come to know that this 12 observation will come. Okay, should the remedies repeated? In what are the conditions we should repeat it? Whether repeated really is needed? If at all we have to repeat the remedy, what remedy? Whether can change the remedy or the same remedy? If same remedy, potency is involved. If you have to change the remedy, what sort of the remedy you should give after that particular remedy. So all these are explained there in this particular observations. And if new prescription, if new remedy, if you want to give to the patient, whether really it is needed. So if it is needed, under which observation the new remedy should be given. For example, you can say first and second observation, what it tells about that. So there, which is pathological changes are occurring where the patient is not getting well and all. So there really is needed repetition or the change of the remedy is needed. If change of the remedy is there, what should be done over? Can we take the case once again, anamnese it, or else we can go ahead with the same remedy or same potency? So all this is dealing in this particular observations. This is what the points are.
Wonderful, sir. I think this is where the philosophy truly becomes practical and clinically alive.
Exactly.
So, one of the biggest fears among the young practitioners is deciding whether to wait or repeat or change the remedy. Why is this decision at that time so critical in successful practice?
Okay, this decision of waiting and okay, fine. So the decision is crucial because every remedy once administered, they initiates an action within the patient's body. That's everything. If the remedy is acting favorably, unnecessary repetition may disturb the patient's vitality or disturb the flow of the medicine over there. If the remedy is completed its action, failure to repeat means once the action is completed, failure to repeat is indicated may allow the cause of the that condition becomes stagnant over there. So all these things are there. At the same time, changing the remedy to means immediately changing the. For example, there are certain conditions where medicine has to be changed. So how to change? Okay, that interrupt the response and create the confusion of the symptom picture or the entire picture of the individual. So that see in the clinic, so we cannot find it out. But if you observe carefully, observation is very important. If you observe carefully of the patient's vitality, energy, you'll come to know that yes, this is the thing which you're repeating is very essential. So this decision making is very, very crucial. Successful. Yes.
I think the term that you have given, the art of waiting itself, is
Yeah.
something everybody should remember. Uh,
Yes, exactly.
Sir, the question which is often repeated in the student's mind, is aggravation always a bad sign, or can it sometimes indicate that the remedy is acting currently?
Okay, this aggravation. This term aggravation is misunderstood as well. So if I say aggravation, definitely aggravation, sometimes it is good, sometimes it is bad. So when it is good, so when we can give the medicine, as per I can give the example of this third observation. How is the aggravation there? Which is very coming very quick, short, and it will last for a time period, short time period. Okay, and at the end, what happens? There is a that improvement of the patient is there. So this type of the aggravation, which always comes there in the you can term it a homeopathic aggravation, but really this homeopathic aggravation we understood properly, not at all. We are just saying yes, aggravation is there means yeah, something is wrong happened to the patient. So, but how will come to the equation? So sometimes my personal opinion that some students came and talk about that doctor yesterday or day before yesterday I have given a medicine to the patient. Now the symptoms are aggravated. Is that homeopathic aggravation? This is what question comes from students. But they are not understanding homeopathic aggression is very short, quick, and strong, and which comes always in the acute conditions. So this condition, and where you will get the homeopathic aggravation there in a chronic case, and has anybody seen that it has been expressed somewhere? Not at all. Homeopathic aggravation always in the acute condition. If at all you to see this aggravation in the chronic case, at the end, whenever the cure is almost complete, that time we are going to see some aggravation which is not understood by the patient because almost everything is clear, but slightly the symptoms comes aggravates and again it goes off. So this understanding of the aggravation is very very important for the physician. Okay, so the aggravation is always not good, but bad aggravation I can say that in the last condition, like you know that uh, aggravation which lasts for the periods together, 1 month,
Hmm.
one week, 2 weeks, and all. So that is not what type of aggravation it is. Whether this aggravation, disease aggravation or medicinal aggravation. Differentiating points one person should understand. Medicinal aggravation, which is remain for a particular period, but disease aggravation is there. It is for a period of long period it will remain. So this has to be understood. Then only you can say this aggravation is good or bad. Otherwise, I can say homeopathic aggravation is good, but other aggravations not at all. Sometimes other aggravations may come along with some unnecessary symptoms also. Unnecessary symptoms which is not at all related to the patient. Sometimes the symptoms which is coming from the patient's past history. Sometimes symptoms comes with the medicinal, which is again we consider as the accessory symptoms. So these are all symptoms to understand our observation should be there. We should observe carefully. Okay, so this is what we again do this. So this is what the activation is there.
Right, sir. Wonderfully explained. Sir, in your
Okay.
teaching experience, what are the most common mistakes students make while just the analysis of the follow-up cases?
Okay, here, students, whenever the student comes, whenever the student take the case at the beginning, they're very excited. I'm taking this case. I want to select the remedy. Definitely, there. See, there is no, you can say, lack of the knowledge of Materia Medica. They are very perfect in Materia Medica, everything. But in the beginning, they are very excited and they can select the remedy perfectly. Okay. But when that next point comes, how this is acting, there, that will become as the biggest challenge to them. That is important over there. And this is what I saw that students are committing some this thing mistake, and not mistakenly it is so something which is called as observation. Understanding the patient's response. So that is lacking, and because of that, the students are not getting better. And one more thing, only on the chief complaints, but other general symptoms. Other general symptoms like pain and all, cough all then, and there is a slight skin eruptions, itching on the skin. So these are the symptoms which are also considered over there. So I can say these are the symptoms which are going to help for the prescription purposes, not the chief complaints. Chief complaints will be there, but along with this, these symptoms also should be considered for the proper prescription. And the next point is coming like changing that remedy quickly. How it is possible to change the remedy immediately? Not what happens here. The first prescription adequate time they are not waiting. You time to the first medicine which is going to act on favorable curative prognosis of the patient or the guest is happening. And the next point, if you want to tell about that is mm, misinterpretation. That is understanding the patient's language. Understanding the patient's language, how the patient is presenting the signs and a misinterpretation of these aggravations. So all this has to be understood properly. Then only there is a proper skill. It is all it
Right.
has been explained.
Right, sir. So one of the most fascinating concepts in the Kent's philosophy also is the return of old symptoms. Why is this observation so important yet so misunderstood by students as well as the practitioners?
Return of the old symptoms is nothing but the action of the vitality of the patient. If
Right.
our remedy which we are prescribing, if it is correct one, definitely old symptoms will come and it will go its own. It will go its own. There is no need of taking those symptoms in our new totality.
Yes.
Most of the time it happens. Old symptoms reappear. That means relapse is taking place. This is what the misconcept is there. So those will come, those will go. Let it come and go. But instead of that, what we are doing, we are taking those in the new totality and prescribing the medicine in the, as a new medicine for the new group of the symptoms. So this is again a wrong way over there. So do not take those old symptoms in a new totality. Always take those in the proper way, understand those new symptoms, and let it come and go. For that, history taking. History is very, that's the reason we are taking the history, past history, present history, medicinal history, disease history, and your life space development. What is the important? This is the importance of that, to see whether these symptoms were there in his past or no. Again, it's relapsing or so. All these things should be understood. That's the reason the old symptoms should come and it will let it go.
Yes,
Yeah.
I think careful observation therefore becomes very, very important
Yes, exactly.
in this situation. Sir, Kent's philosophy, the whole philosophy plus the 12 observations is often considered difficult and abstract by the students. What approach have you taken in your book, Kent's Observation, to simplify these concepts for practical understanding by the students?
Okay. Approach. Okay. The primary motivation is behind this particular book is realization this many student and young practitioners finds philosophical background or the profound but difficult to apply those in daily practices. That is one thing. While Kant's observations are invaluable, they are often presented in manner that appears theoretical, living like this particular uncertainty will be there. So all this uncertainty about how we use them when we're sitting in front of the patient during follow-up and consultation out. So all these things are there to consider. In this particular book which we have written it here, we've taken practical and student-friendly approach to simplify these particular concepts, whichever is there, rather than merely presenting Kate's observation as philosophical statement. Yeah, I explained in this particular book, the observation is in a clear and straightforward language. We have done some tabulated form also in this book. Tabulated in the sense all 12 observations, along with what is the inference of that and what is to be done in next follow. Everything is explained in the tabulated form. So if you see this table is sufficient enough. This particular I can visible to you all. So this table is
Yes, sir.
sufficient enough to understand all the 12 observations in one glance. What is to be done? It is there in that. Okay, at the same time, okay, this is about the Kent. What Hahnemann has told, because it is not like that Hahnemann has not anything about these observations. Definitely Hahnemann has. So what I have done is that in each observation, what aphorisms are coming, related aphorisms and their interpretation, both are similar or no. This is what my thought is there, and obviously it is same. What Hahnemann has thought, what Kent is writing as observation. Hahnemann has given in philosophical and long essay form. So I combined all the things. I explained all the observations. At the end, we are kept as the what aphorisms are there from the organ text. So if you read those, it's well and good for the student purpose. Very very good book, I can say. So they can at the same time they can read the philosophy as well as the organons. So this is what the
Excellent.
book about philosophy, the still observations.
Excellent, sir. This is for the students. Also, tell us about that. Modern practitioners sometimes interfere quickly into, interfering the action of the remedy, maybe because of the impatience or the pressure for immediate results. Uh, how do you interpret that, and how this book can help them also?
So intervening the medication is, I can say, it's a wrong thing. Okay, don't intervene the any medication abruptly. So this book has given so many examples. Dr. Kent has given some cases and all. So say those cases I have explained in this. How it is related to the first prescription, how it is related to the second prescription. If for practitioner also it is very good. They can see that results. Okay, it is not the day-to-day practice. From Kent also we have taken, and from our hospitals also we have taken some cases and we have put it in this, so that it will be easy to understand what is to be done. So most of the time, what happens, the physician, as you said, they spoil the well-selected prescription and all, simply by making some wrong decisions during follow-up. So this is definitely, I can say that, being a homeopathic physician, we should not disturb the natural flow of the medicine, natural flow of the disease. Whatever the symptoms are coming, it's naturally it is coming. So don't disturb that. Those symptoms are going to help you to decide what is to be done in future. So if you disturb that with the intervening some other medication, definitely it's going to spoil. So don't spoil the flow of the medicine and the patient's signs and symptoms. So this is how the patient is not getting cure immediately. And most of the time it happens that immediate patients also coming and they need immediate immediate cure. And some it is myth that okay, homeopathy will not be good in acute conditions, or you can say the immediate patient is not getting cured immediately. Fast, in other words, layman language can say fast recovery is not there. But that is also wrong. We have seen, but not in our practice, but we have seen, we have heard, we have read somewhere that so even in the myocardial infarctions also some homeopathic medicines are available. For example, this Aconite, what we are using. MI comes and you can put 1 or 2 drops under the tongue and all. So definitely it will act as nitroglycerins. So this is what I have read somewhere. But definitely there is action because we have seen this Aconite also has got some actions on the this thing says severe circulatory systems. So that definitely is going to act on. So instead of spoiling the case, you just try to not spoil with intervening this particular medicine. Most of the physicians, I can say, I see here somewhere, so they are intervening unnecessarily to get a faster result. So instead of that, take this case and understand it and repeat the medicine if at all it is needed. Repeat it. Repetition, how it should be done? The question, most of the students they come and so repetition, we are going to repeat the medicine. How to repeat the medicine? That's a big question. And even himself has told, repeat the medicine and in the higher attenuations. It is not absolutely advisable to give the same potency as told in his efforts. But intensifying the same medicine and students, I have seen some students are coming and telling, sir, we have got only 30 200 potency and 1M potency. So in between there are no potencies. This also to be understood now. So 30 potency, they directly jump to the 200 potency. Why not next potency? Anyone has not told like give 38, give 200. No. After 30th potency, you can increase a bit. Specifically use that word. A bit means slight intensification of the previous medication. How it has been done, that also is explained in the aphorisms. I think everybody knows it. No need to explain those things. Everybody knows how to intensify the previous medicine and give it to them. So that has to be followed. How it is. So even Kent has told, give the next potency. Next potency has not told which potency. We should understand that next potency itself is nothing but a slight intensification of previous potency. If you give like this, if you do like that, there is no spoiling the case plan. Everything will be fine. So this understanding and observation, keen observation, very, very essential.
True, sir. For the cases in which the first prescription is correct, can a physician still spoil a well-selected prescription simply by making wrong decision during the follow-up? So can a second prescription make it a huge difference?
Definitely, definitely. Because first prescription is given medication which is showing the proper result. So that is interrupted by the second prescription, second follow. The best we know the best follow-up remedy is this thing, what placebo. Why can't you give the placebo only? Give the placebo, keep that patient on the first prescription medicine, wait, see how it is responding. Okay. I can't see there is one remedy called as so remedy which has example XYZ remedy which has got a time duration of a 21 or 28 days is there. Okay, now I give the medicine today. So can I wait 21 days? No, not at all, not needed there. If a medicine is given, if the condition is favorable enough, if patient is responding properly, I can give the same medicine high potency. Instead of that, giving other potency definitely is going to spoil only, as you said. So that is not at all recommended. If it is required, repeat it. If it is not required, don't repeat it. Keep it like that only. If at all you want to give, there is a condition called a stagnant condition. That medicine stops there, not acting further. So there also we should give some other remedies, which is follow well and supplementary remedy. That has to be thought properly. So this is how you should understand and prescribe the proper remedies
Yes,
for
sir. So
students
this
and
really that highlights how follow-up itself is an art.
yeah, this is art. Absolutely, it's an art.
Sir, as academician of all these years of so much extensive teaching experience, what inspired you personally to write this book for students and young practitioners?
So basically, I was thinking about the students because students are see, they understand everything. I don't say that they won't understand. They understand everything, but not in the depth. Just superficial level, they understand the concept of this particular about the prescription, about the patient understanding, about giving a follow-up and everything they understand. But they have some doubts. They have a fear over there in the follow-up case, not at the beginning. Fear will be. They fear that can I wait? If I wait, what is going to happen? Whether this remedy is not active, can I wait or not? If I can't wait, if remedy is need, repetition is needed, can I give right now the remedy? So these are all whatever they are thinking. No, these are nothing but the fear in their mind. So that fear will abolish if you understand this all 12 observation properly. This only this thought only inspired me to do something for the student level. At the same time, they are reading this organelle also. Now, Hahnemann and Kent, these two different things are there. These two different. Hahnemann concept, his thoughts are they different and Kant's thoughts are different. So I wanted to make one small connection in between these two. Organ and what Hahnemann has taught, Kent to Hahnemann, Kent what he has taught. So all the things are the same. There is no change at all. Only thing that the way of presentation of their thoughts is maybe different. Otherwise, everything will be same. This is what I can say about it.
Wonderful vision you have come up with, sir. Audience, before we take the final question
Yeah.
with sir, audience, before we take the final question with sir, if you have any questions, please put them in the Q&A box and we will try to take them with sir at the end of this presentation. Sir, finally, if there is any message you would like to give to any young practitioner or homeopath who is listening to remember about follow-up or prescriptions in the second, follow-up of the patients, any message from your end?
Message, okay, very good. It's very essential to give some message because take-home message should be
Yes,
there in all
yes,
sessions. Okay,
yes, yes.
so I can say one sentence. It includes everything in that. So that sentence goes like that: a correct prescription is very, very important. Okay, whatever the prescription is, very, very important. But understanding what happens after that prescription is even more important than that. So these all are the things, whatever right now we discussed, how the medicine has to be given, whether to repeat or not to repeat, or else we can do some other medication. And can we start can we take one more totality of symptoms? All these things comes under this. If you observe carefully, everything will be fine. Patience is very essential. Patience and observations and the knowledge already we have, only thing that implementation of that knowledge at particular moment is very essential. So this only one sentence, the correct prescription is important, but understanding what happens after that prescription is even more important. This is what the take home message I can give to my students. So
Very well said, sir. If you allow, I will take a couple of questions that are
yeah,
coming
sure,
from
sure,
the
sure,
audience.
sure.
So the name is not mentioned, but our attendee has asked, in case of a respiratory complaint of a patient, after the prescription is done, the patient gets urticaria on the skin. So what should be the
Okay,
next step in this case?
okay, very good. First, respiratory symptoms are there, then urticaria symptoms. That means that anonymous, any person has given asked whether student or pet, I don't know. But the thing is that here the one point should be understood that Herring's law, that is from within outward if it is going. These respiratory symptoms are better now. But the thing is that externally on the skin, the eruptions are coming, area symptoms are. So now wait here, articular symptoms are coming out, means it is the from within outward. The cure process is taking place in this patient. So no need to disturb this respiratory, this flow of the medication to the patient. This is what I can tell. If at all you will prescribe some medicine, again it will suppress over there. Suppression again goes inside, again respiratory may come. We can't tell respiration only. We may go suppression anywhere in the vital organs. So from vital organ, it has come outside. That means this process of the cure is taking place. Just wait and watch what is going to happen. It will go its own. If at all the process of flow is not disturbed. If you want to
Right,
give
sir.
some medication, definitely medicine all depends upon the history and patient's totality. We cannot tell the medicine right now here. So don't expect that. The real thing is that this Herring's law is following over here. Once Herring's law is following means definitely cure is going to take place.
Right, sir. Dr. Rachita is asking how to make a difference whether this is a disease aggravation or homeopathic aggravation, because
Very good.
theoretically it is clear, but in practice it becomes very difficult.
Yes. I'll tell you. See, homeopathic aggravation, as everybody knows that it is very short, quick, and strong. Yeah? But the aggravation which is coming from the medicine, so that will come. See, we know that medicine will act its own and it will go its own. So no need to worry about the medicinal aggravation only. Once the medicinal aggravation comes, it will remain in the body. It will show signs and symptoms, particular signs and symptoms, and it will do its own after completion of its action on the body. So there is no need to worry this medicinal aggravation. And this medicinal aggravation we cannot take there in the totality. Most of the students they consider this medicinal aggravation and they take this medicinal aggravation in the totality and prescribe the new medication. So that mistake should not be done. Medicinal aggravation
Right,
comes
sir.
and go. This
Right,
is
sir.
one answer I can give to that demand for that. Any other questions?
Uh, yes, sir. We have a question by Dr. Yogender. Although there are many cases which are mentioned in your book, any one particular case that you would like to, tell to the audience how Kent's observation helped in tracing the follow-up and finding the success?
Yeah, there are so many examples we are given here, cases we are given here. So one case I'll tell you. Hence the case I'll tell you here. Okay, so an observation, fifth observation, clinical illustration case, fifth observation is there. So here one case is there. The Here, what happens in a clinical illustration case observation, a woman, I'll just read this case for you people because it's a case which is there in the book and all. So, woman middle aged developed acute pleurisy following the exposure to cold air while sitting close to open windows. She developed severe stitching pain in the right side of chest, extending through the lungs in multiple directions, on which she screamed in anguish. The pain was increased by the slightest movement, and she had short labored breathing and extreme restlessness, though even movement increased her pain. One dry dose of aconite was taken on the tongue, which provided temporary relief for a couple of hours, but then the symptoms reappeared with their initial intensity. Reappearance of the symptoms with the initial intensity. The remedy was next repeated another from the sixth pallet of the same strain dissolved in water. So here again, the medicine which we are given, it is a higher intensity. Dissolved in water, as per Hahnemann's thought, it is that. And after the first teaspoon, the patient dropped off into the profound quiet sleep and later wakened up to warm, copious sweat. By next day, she informed a full relief with no lingering pain and no difficulty breathing. What it indicates? That indicates that there is no aggravation. Patient is better with that particular this thing. So here what happens, the interpretation context, fifth observation also I have explained here. So all the observations, all the cases which is related over there, everything systematically arranged over. So if you go through, you'll understand and it will help for your clinical.
Yes,
Yes, ma'am.
sir. So that's all for the questions, sir. Thank you so much. Dr. Kamar, it has been a truly wonderful and thought-provoking conversation with you. The upcoming book promises to make one of the most important yet challenging areas of homeopathy more practical, understandable, and clinically useful for students and practitioners alike. And I'm sure our listeners have gained valuable insights today into the importance of observation, importance of patience, and importance of correct follow-up by listening to you. And to our listeners, if you wish to strengthen your clinical confidence and understanding the deeper practical application of Kent's philosophy, please get your copy of Dr. Shashikant Kammar's book, Kent's Observation. The upcoming title will be available on BHMS website as well as on other portals. The information will be available on Homeopathy 360. And sir, on behalf of the entire publishing team and Homeopathy 360, we are grateful to you for taking time out. Any small message that you want to give to BHMS or Homeopathy 360?
Message in the sense, I can tell that it's a good opportunity for me to get this VGen in my for my book and all. I want to very much thankful to this VGen and all the publishers. Even the ma'am was also there to help me a lot for publishing this. Thank you very much.
Absolutely, Sat. It is always a pleasure to have authors and teachers like you. Uh, that's all for today. Thank you so much, sir. Once again, thank you, audience, for joining. Goodbye, everyone.
Thank you very much. Thank you. Bye.
Bye bye.